Welcome. It is that time. It is Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injuries. It is the first Ask Dr. Geier Live of 2025. I am thrilled that you're here to join us, whether you're watching this right now live or you're coming back later to watch it. I am thrilled that you are here. This is also the first time that we are trying Monday afternoon. I have tried various times through the 4 or so years I've done these live shows. I've done most recently Friday at 12 p.m. Eastern Time, noon, but I've also done late Thursday afternoons. I have done Wednesday nights. I've done Monday nights. And so we're just going to give this a try. I'd gotten a number of comments that people were having trouble making it at lunchtime depending on their time zones. And Friday was potentially bad. So we're going to give this a try at least for maybe the first half of 2025. And then we will reconvene on what we do going forward. I do like this time, so we may stick with it. As always, none of my answers in this show, just like all my videos on my YouTube channel and X and on my website and everywhere else, I'm not giving you medical advice. This is meant for general information and educational purposes only. I haven't seen you, I haven't examined you, looked at x-rays, MRIs, any of that, so I am not giving you medical advice. What I'm hoping you can do with that is take this information, and then when you go see your doctor or you go see your orthopedic surgeon, you're now armed with information to help basically ask better questions or better understand what he or she is saying. Or maybe you're doing it on the opposite end. You've already seen your doctor, orthopedic surgeon. Now you're trying to come here maybe for translation because you didn't understand what he or she said. And I am happy to do that. I am just not telling you what you should do because you're not my patient. I'm not your doctor. If you want more information about potentially seeing me as a patient, there's information in the description below this video. Click that link. Not only do you get a free ebook that I wrote, The Arthritis Solution, but you will get information on how you could potentially see me as a patient. Also, if you're going to leave a question, if you're on YouTube, leave it in the chat, not in the comments. I cannot see the comments. Every time there's 3 or 4 people that do it and I never see it, and I'm sorry, but the system that I'm on, I'm not actually on YouTube right now, so I can't see it. The chat is pulled over through a service called Restream. That's what allows me to send it out to different places, so I can't see it there. If you're on X and you want to leave a question, sometimes those come through, sometimes they don't. So if I'm not answering your question, go over to the YouTube stream, subscribe there, click the bell. You can be notified that whenever I start a live show, but then enter your questions in the chat. And for that, that's what it's worth. I have no idea what Noob Pyrotechnic is saying about good idea, but I appreciate it. Like I say, I do try to do these at times that are best for as many people as possible, but especially if you watched the Friday noon shows, a huge number of my viewers were from Europe and from Africa and the Middle East, and were many hours ahead. So we may lose some of them, but the flip side is people west of here were having trouble doing noon. So it's sort of a balance. There's never necessarily a right way. Peter asks, should penicillin injections be discontinued before or after PRP for osteoarthritis? To be fair, it's never been studied for that. I mean, right now we're still on studies just testing its efficacy for osteoarthritis, at least with the FDA, those phase 3 trials. To my knowledge, Paradigm or really nobody else has done any studies on it with respect to PRP. I personally would have no reservations with it like I would ibuprofen or naproxen, but that is just me. It has not been studied. There probably would be very little downside to stopping it for a period of time before or after, but I doubt that it would interfere in any way with the mechanism of action of PRP. I'm sort of lukewarm on PRP for osteoarthritis, so I'm sort of hedging my bets there. I know the studies are okay for improvement of pain, improvement of function, but I think there are better things out there. But I do think penicillin can be helpful, and I personally wouldn't stop it. But again, not medical advice. All right, Kathy. And I apologize, I am under the weather and have been for about a week, so if I cough a lot or my voice sounds bad, that's why. 57-year-old female in October was diagnosed with a meniscus tear down to the posterior root, have no pain, don't want surgery, haven't returned to work, will be starting PT soon. Again, not medical advice, Kathy, but I applaud that. I would think that is a strategy that I would tell a 50-ish year old, 50s, 57, I think she said, patient that came into my office, symptomatic or not, I would at least try non-surgical treatment. And the reason is degenerative meniscus tears, which it almost always is past 40 years old. Those have an abysmal track record if you read the studies in terms of long-term functions. If you go in and do what's called a partial meniscectomy, go in and trim out the torn part of the meniscus, and that's how most of those tears are. They're not repairable, and that leads to quicker progression of arthritis, minimal, if any, pain relief. It just is not really considered standard of care. Having said that, tons and tons of orthopedic surgeons still do that and probably would in this scenario. I don't know that that's necessarily the right idea. It's not to say that there aren't ever reasons you wouldn't go in and scope the knee, but just as first line treatment, I don't think many people, it's just not what the studies suggest anymore. Noob says, good idea switching the days of the week. Yeah, I mean, I'm not going to be able to please everybody, and we're going to try this for 4 to 6 months and then reassess. I like it. Do I do telehealth medicine? Do I take patients out of state? Yes and no. I only have licenses in North and South Carolina. So people outside of those states, the other 48 states, I will do a telehealth visit. It's not medical advice. It's just sort of understanding the problem. And this is what I would do with patients that had that problem should they come to my office. But then if you're not in North or South Carolina, you've at least got to come to our office in Charleston, South Carolina, at least once. I have considered the idea of trying to get licenses in the other 48 states. It is not really a good use of my time, quite honestly. And so that is how we do it. And so I have lots of patients in other states, but yes, they do come to see me at least once. And that's, you can be upset with me all you want. You need to call your congressmen and senators. That's a federal issue where there probably should be a federal medical license, in my opinion, but basically they've sort of delegated it to all the individual states. And you have to realize these state medical boards, medical licenses in those states is their by far biggest source of income. And so if that's taken away from them, they won't exist anymore. And they've got other functions. They've got to do disciplinary issues. They've got education and a number of things, license maintenance and a whole number of things. And so without the money that would come in from basically annual renewal fees and paying for a license, they would cease to exist. So I don't see that going away anytime soon. But yes, I would love to see us go to a federal medical license. All right, Peter, what's better for PRP than what's better? Again, I told you I'm not feeling good, and so that's why I can't read today, apparently. Better for PRP. The data for PRP is not terribly impressive. It's certainly better than steroid injections. It's certainly better than hyaluronic acid injections, both of which, but hyaluronic acid doesn't really have any big downsides. The data is not terribly good on not just pain relief, but certainly on regenerating cartilage. PRP is better than that, and at least PRP is not scrutinized the way some of the regenerative treatments are that I talk about. I've got videos about all of this, whether it's stem cells from where you're in a place, especially in other countries, where they can take functional stem cells and replicate them to deliver hundreds of millions or billions of stem cells, or stem cells from amniotic fluid, that type of thing, Wharton's jelly, exosomes. There's lots of options. They are all considered experimental in the United States because of the FDA, and the FDA strongly discourages regenerative products from other people, from other, basically not from you. That's the upside of PRP, is that it comes from you. There are ways to do exosomes from you, and I have heard the data on that is relatively good. I know there are a number of people that are questioning how well that is. I don't have a lot of experience with that, but I think that there are potentially a lot of things out there. Again, because they're experimental and because I'm not giving medical advice, I'm not going to say one or the other. Like, this is definitely what I do. And I don't think there's any one answer for osteoarthritis. We talked about penicillin earlier. I think that can be very important. There's other medications that can be helpful. There's other supplements that can be helpful, peptides that can be helpful. It's not any one thing in my experience. Joel Rice, hello. Apologize. Hello, doctor. Had a patellar quad rupture 20 weeks later during rehab doing slant board squats. Fractured my patella. Fracture was horizontal. Neither my surgeon or PT have ever seen this. Yeah, that's a tough problem. It reminds me a little bit of if you remember, Jerry Rice, the San Francisco 49ers wide receiver, had a bone patella tendon bone autograft for an ACL reconstruction, really pushed himself hard in the recovery. First game back, fractured his patella, and the assumption is that the graft, the ACL, did well, but there was still incomplete healing, so to speak, or that patella was a little weaker at that point than it would be later in the process, and that's potentially why he fractured his patella. This seems like a similar thing. I haven't seen that either, to be honest. I've never honestly seen a patellar tendon and quad tendon rupture. It's usually one or the other. In fact, I've never seen that, but even then, I could theoretically see a scenario where, say, a patellar tendon repair that goes on to heal, and then in the force of it, because you're again drilling holes through the patella to anchor the sutures on the top side of the patella. If it's a quad tendon, it's basically the opposite. You're drilling them through the patella and anchoring those stitches to the bottom of the patella. I could see a scenario where that would happen, but I can't say that I've seen it or really heard my colleagues talk about it. But very tough problem. Now you got to go through the process, probably surgically, to get the patella to line up perfectly and hold it in place, usually with screws or a tension band and wires, and then get that to heal. Very, very tough problem. You talk about loss of range of motion and loss of strength. That's going to be a lot of work getting those two back to baseline. I definitely don't envy you, but good luck with that for sure, Joel. Peter, a lot of questions today. I appreciate it, my man. Could varus negatively affect ankle function, cause osteoarthritis in the ankle? I assume what you mean is a varus alignment of the knee. Yes, anytime you alter the mechanical axis, whether it falls varus, where it's bow-legged, for sort of put in layman's terms, or it's valgus, which is knock-kneed, you're putting the weight off of where it normally goes and into another area. It doesn't absolutely lead to arthritis of a joint below it, but certainly can, for sure. PLD, grade 3 MCL, they installed a cadaver ligament 6 months ago. Had 12 weeks PT, range of motions come back, have to do an hour of stretching every morning when I get out of bed. Is this normal? A couple things. I'm assuming that's an MCL of the knee and not MCL medial collateral ligament of the elbow. Typically, yeah, so they installed a cadaver ligament. If they did a MCL reconstruction, I assume that what that means, then you're basically trying to get that graft to become a new MCL. I don't know personally. I don't restrict range of motion after an MCL surgery, whether it's a repair or reconstruction. I allow flexion extension. I just have the patient wear a brace to eliminate side-to-side forces and side-to-side stresses on the repair. So motion typically isn't that hard to get back. But if for some reason people are struggling to get motion back, you've got to do whatever it takes to get it. A stiff joint after surgery is very hard to overcome once it happens. And so the key is to keep it from getting stiff, especially in the case of the knee, getting it all the way flat within days or a week or two at most after surgery, and then getting the full bending back by about 4 to 6 weeks. It can be really hard once that has become slow and stiff to get the rest of that motion back. Don't know, again, if that's exactly what happened in your case, but that's kind of what you talk about. Warthog asks, how do you make an appointment out of state? You just, you could go to, there's a link in the description below that gets to me and my assistant, and we can set it up. Again, at some point, if you're not in North or South Carolina, you're going to have to come to Charleston, and if you're not willing to do that, that telemedicine appointment really becomes unnecessary, and a lot of times we won't set that up. We'll save you the money and save you the time, because it's illegal for us to prescribe medicines, prescribe treatments, whatever it is, in states where we don't have licenses. But if you can get here even once, and literally half of my patients come from all over the country and not from North and South Carolina, so people find ways to make that work. We'll work with your time frame and travel and however that is. And then Noob says, had a clinic advise me BPC 157 injection was taken off the market. They say it's in pill form. I do not think that's actually the case. There may be compounding pharmacies struggling to get it, but I am not aware that it is not taken off the market. And I just, that's one of those ask me how I know. I know you can get it. As I've said lots of times in response to peptides, and that'll be our last question for today, I strongly recommend you get them from prescribed by a physician, prescribed through a licensed compounding pharmacy. And my understanding is most of the licensed approved compounding pharmacies that are inspected by the FDA, they're not having trouble getting them. Yes, I know the FDA is putting out a lot of language, or has, about BPC 157, CJC 1295, thymosin beta 4, and some others, saying that they're going to ban them. It has not happened yet. I don't know if that was all just posturing. I'm not sure exactly the thought there, but I am not under the impression that some of these are, or at least I know a lot of them are not having trouble doing that. As far as oral versus injectable, I've never seen or heard that much in the way of success with oral BPC, at least for musculoskeletal injuries. I think it might be good for digestive issues, GI type things, but I'm underwhelmed with it orally. I have also been underwhelmed with topical forms of it. I've tested it from a compounding pharmacy, and I couldn't tell really anything. That's anecdotal and of one type of thing, so take that for what it's worth. The molecule size is probably big enough that it's not getting absorbed, quite honestly, transdermally. But having said that, I think that there are ways to get it legitimately and still get it today, but I would strongly avoid doing the websites online. Most of that is probably not real anyway. All right, I very much appreciate it. I hope you have a great rest of your day and great rest of your month. If you have other questions, definitely keep those coming on YouTube. I keep recording new videos based on your questions, so definitely do that as well. I'll be back here Monday, March 3rd to do my next Ask Dr. Geier Live, and I very, very much look forward to it. We had good turnout today, so this new time may be a hit. I look forward to seeing you then.